case in most centers. Such a conclusion was arrived at by performing 25,000 TURPs and 250 pull-ups. Any patient who can be anesthetized can be taken up for pull-up, especially patients on anticoagulants. Even heparin can also be selected without adding morbidity, mortality, or extended hospital stay. These results can be emulated by meticulously following the techniques which I am going to show here. You need an ideal setup. The first step is to assess the gland properly by a scopy. Here I am showing the 2-lobe and 3-lobe together because both are same, almost same. First incision is at 5 o'clock. Actually, it is not an incision, it's a crater whereby you improve the flow. Next important step is to identify the bladder neck properly, because when you retrogradal way, when you elevate the lobe, sometimes you may enter the bladder. This will be prevented by this technique. This is specifically designed by us, where you have a mucosal elevation technique near the apex, where you 2 cm proximal to the verumentinum, we elevate the mucosa only, then lift the apex with the equipment thick so that the injury to the sphincter is less. Now you can lift the entire left lobe from the apex, then go proximally. When you go proximally, your outflow gets blocked. You can put a suprapubic initial puncture needle and get a better flow. Then you connect the roof to the from the bladder neck to the apex. So you are encircling the entire lobe. Now you can see the correct plane by seeing the fibers. If it is yellowish, means you are in the wrong plane. Go proximally, lift up the whole lobe properly. Now you can see a technique here where I am not detaching the tissue there, I am attaching to that place. Now I go to the 7 o'clock position and lift the median lobe at this stage only. Never attempt to go do the median lobe first, because when you move the scope for the left lobe, you are likely to undermine the bladder neck and likely to chance for extravasation is very high. Now I am after the left lobe, I am elevating the median lobe and pushing into the bladder. Then the same technique is